Ji, Assalamu alaikum students. Now have a brief review on today's lecture, which was components of a disease process. Students, keep one thing in mind, that these are the phases or stages of a generalized disease process. It never means components of an infection. So we have got stages of a disease process. Number one, etiology. Etiology means cause of the disease. In etiology, we have biological causes, for example, bacteria, viruses, fungi, they leads to disease. Physical causes, for example, extremes of temperature. Chemical means thermal injury, chemical injury, genetic factors and environmental factors. All these factors leads to disease. Now students, sometimes the etiological factors of the disease may be grouped into acquired factors and congenital factors. Now second stage is pathogenesis. Pathogenesis means evolution of a disease. It means these cellular changes which takes place in the body throughout the disease process. Pathogenesis. Next we have morphology. Students, morphology is a combination of gross anatomical changes as well as cellular changes which takes place in the human body during the course of the disease. Number 4 point, clinical manifestations. Clinical manifestations, students, include signs and symptoms of the disease. What are signs? Signs is an observation of a technical person of manifestations of the disease. And what are symptoms? Symptoms are manifestations observed by the patient itself. Now we have got diagnosis. Students, to reach the diagnosis, we take help of clinical history, general physical examination, lab investigations and treatment options. Number 6 points, we have clinical course. Clinical course means through which passage a disease will turn into. A disease may adopt acute phase, a disease may become chronic, and it may adopt subacute appearance. And last point is students' outcome. Outcome of the disease means fate of the disease. Either the disease will regress, either the disease will turn into chronic one, or the disease will lead to complications, or ultimately the disease may cause fatal death. Now students, we have got risk factors of a disease. What are risk factors? Risk factors are the conditions suspected of contributing to the development of the disease. It means we suspect these factors in the contribution of the disease. How we can suspect these risk factors? Students, we assess these risk factors with the help of these 3 types of observations which are called studies. Number 1, we have got cross-sectional study. Number 2, case control study. And number C, cohort study. Students, these 3 studies enable a researcher to reach a diagnosis and risk factors of the disease. Now, prevention of the disease. Students, for the prevention of any disease process, 3 stages are involved. Number 1, primary prevention. Primary prevention means elimination of all the risk factors of a disease. Removal of risk factors of the disease before its incidence. Examples of primary prevention includes immunization of children, use of folic acid during pregnancy. Now students, we have got secondary prevention. Secondary prevention means early detection as well as treatment of the disease still in asymptomatic phase. It means the disease is in the asymptomatic stage and the physician recognizes the disease by secondary prevention. Students, number third, tertiary prevention. Tertiary prevention means reduction of complications of a disease process. So in any disease process we have got primary prevention, secondary prevention and tertiary prevention. Thank you students. Allah Hafiz.